This is session 8. Thank you for coming back and joining us after the break. This title of this presentation is Charting the Course in the Evolving Health Coach Landscape, Safeguarding Against Fraud and Upholding Care Standards. With us today, we have Charla Burr, who's an attorney. She's also Senior Director of the Academy of Nutrition and Dietetics. And we have Rebecca Simone, a partner at Nixon Peabody. Nixon Peabody is also on our legal resource team. So we thank you for joining us today. And as you see on your agenda, we have key questions and we have tabletop discussions, which we intend to give you all about 3 to 5 minutes to have a conversation about. But let's first get started with introductions. I'm going to hand it over to Charla.
Can I use the podium?
Absolutely.
Okay.
Turn this off, sorry.
You're good. Whoops. We good? I'm like, is it there? All right. Well, before I jump in and give an introduction, we are talking about health coaching today and what that looks like. How many are working with or have worked with a health coach or know much about that landscape? So, a few in the room? Okay. Well, just good to get an understanding what we're talking about. I'm Charla Burr. As she said, I'm with the Academy of Nutrition and Dietetics. Before that role, so I work over our state policy and legislative affairs, and mainly one of my main focuses is licensure and our licensure compact, and then also telehealth. And prior to that role, I was with the North Carolina Board of Dietetics and Nutrition, where I was our executive director for 12 years. And so for me, the landscape of health coaching, it's crossed my path many times. I wouldn't say I'm an expert in it, so as far as what health coaching is, but I've spent a lot of time thinking about it and encountering it from an enforcement side. And so that's what I'm bringing to the table for you, and just to, I guess, pose some questions before you if you have not thought about this issue, especially with the explosion in telehealth. I know with Krista and I, we've talked many times about with the increase in telehealth and what providers are looking to health coaching to help, provide services. It's being marketed to providers on a wide scale as a way to really grow their practice. And so there's definitely some considerations that we want to be giving to this field. At the end of the day, I'm not here to bash health coaching on any side. I know I represent dietitians from my side, and we do have dietitians that practice in the health coaching field, and then we also have unlicensed persons that provide health coaching services. Health coaching in itself, I think, has many benefits. So there's personal insight, self-directed goal setting, accountability, empowerment, all good things. One of the health coaches that I talked to, she framed it up as it empowers people to move forward towards self-efficacy and the well-being that they desire. And so in its essence, I think we'd all say that's good things that can come from that. Where we see concern is the fact that it is a fairly new growing field. It has some roots back in the 70s with employers and wellness types programs, and really took off in the 2000s, or 2000, early 2000. But it hasn't really been regulated on any level. So it's sort of growing and sort of this explosion, and then comes telehealth, and it just continues to advance without really any parameters put on it or any rails. At the end of the day, there is an organization out there. It's the National Board for Health and Wellness Coaching that has come about in the past 10 years that is sort of trying to serve in that role of what maybe licensing or regulation would on some level. And the first thing that they have offered is a scope of practice for the profession. And I'm going to read to you that scope of practice just because I think it sets a good context for what we are talking about when we talk about health coaching. Because when you look at the landscape, it's hard to know what are the limits for a health coach. It seems like they can almost do everything under the sun on some level, and what is being offered to you. So if we take this professional body that is serving to accredit health coaches and really ground ourselves in that scope of practice, I think would help guide you as a provider in terms of, is this appropriate relationship? Is this the services I should be having them provide, especially in your telehealth practice or even on the ground practice? So here, bear with me as I read this and just think about a health coach. So the coach's role is one of accountability partner, not director, in navigating behavioral change and exploring opportunities for growth and development. As facilitators of the behavior change process, health and wellness coaches support clients to achieve self-directed goals and behavioral changes consistent with the client's vision for health and well-being, informed by any treatment plans prescribed by the client's professional healthcare team. When appropriate, health and wellness coaches may offer evidence-based resources or information from nationally recognized authorities. Additionally, when working under the license of a qualified medical or allied health professional, physician, psychologist, physical therapist, health and wellness coaches may support the implementation of those professionals' treatment plans. Key here at the end, on their own, however, coaches themselves do not diagnose, interpret medical data, prescribe or deprescribe, recommend supplements, provide nutrition consultation or create meal plans, provide exercise prescription or instruction, consult and advise, or provide psychological, therapeutic interventions or treatment. So that was a lot, but I say that because it really struck home to me as someone that has come across health coaches often from a side of enforcement and concerns that they have been violating our Practice Act. And when I look at that, that is not the context that I have seen the coaches that many of the coaches that I've encountered working in. And so that is concerning to me. Additionally, as I was preparing for this and looking into this, you can see as you look out across the landscape, there's development of health coaching, certifying or credentialing type programs. But then additional, whether you want to call it continuing ed or additional certifications that health coaches can get. And one of those is a functional diagnostic health coach or a functional medicine health coach. And when I look at those things and look how they describe the courses and what's provided and the fact that they have them reviewing labs and all that, I don't know how you reconcile the two, that this is the scope of practice and yet we're giving them more. And so from that side, I just question where health coaching is actually going and what it truly is. Either it is that scope of practice or it's not. And if it's not that scope of practice, then the question is, are they actually coaching? Are they providing a service for which a license is likely already required in a state, whether that's nursing, counseling, or practicing, medical nutrition therapy in our world, or dietetics and nutrition? So that's how we've come across this space. And as a provider, health coaches are, as I said earlier, are being marketed as a tool to really grow and bring income into your practice. There's a significant health coaching body out there that one of the lines I saw from them is, with a coach on your team, you can bill approximately $200,000 per year in annual wellness, chronic care, and obesity counseling visits, both individual and group visits. So I think it's in that context that, because we'll talk about a little bit later, the fact that they can't directly bill, but billing under a provider. And so then you can see where that raises some more concerns of what service are they actually providing and what should a provider be concerned in terms of the scope that they're operating in. So with that, I'll let my colleague give you some more thoughts and then we'll jump into some other issues.
Thank you. Can you hear me? Yes? Oh, good. Hi, everyone. So my name is Rebecca Simone. As Krista said, I'm a partner in the healthcare group at Nixon Peabody. I am 100% healthcare regulatory and transactional attorney. So I'm outside healthcare regulatory counsel, and I've been with my firm for 16 years advising clients on how to run their healthcare practices, facilities, or companies compliantly. And so today I'm heavily focused on telehealth and digital health. And today, I hear a lot of my clients talk about unlicensed personnel as coaches, but I do want to, talk a little bit about kind of historically unlicensed personnel being involved in the healthcare ecosystem. For example, medical assistants. So some states license and certify medical assistants, but many, like New York, where I'm from, don't. So a medical assistant, I'm sure as you all know, will take information, height, weight, blood pressure, and they work under the supervision of a physician or a nurse practitioner. And it is completely permissible for physicians and nurse practitioners to delegate certain tasks to unlicensed personnel, so long as that personnel is appropriately supervised and appropriately trained. So you hear kind of like the weaving into what Charlotte was talking about. Health coaches can be supervised, but the scope of what they do needs to be well defined. Another area which is surprising to some people, but maybe not in this room, is phlebotomy. So most states do not require phlebotomists to be licensed or certified to draw blood. A lot of lay people get shocked by that. but it comes to supervision and training and the licensed person that is actually involved. So a phlebotomist will either work for a physician practice, and it's that doctor's responsibility to make sure that the people they've hired to draw blood are appropriately trained and supervised. And in fact, it will fall on that doctor's license if they are not. If a patient gets hurt, the phlebotomist doesn't have any special license. They don't have malpractice insurance. It's the responsibility of the physician. So, translate that into coach. If a physician hires an unlicensed coach to provide services in their practice, the ultimate liability will be on that physician. Another area that I think really weaves into current day coaching is home health aides. So home health aides in most states don't need a special license, but most states have specific regulations that say what type of training home health aides need to get. And those home health aides will be employed by licensed entities or facilities. And usually they work under some type of supervision of a nurse and pursuant to a treatment plan from a physician. And so, not to read you more quotes, but I have one here, and we didn't even plan this, but from New York Department of Health about what home health agents do. And it's very similar to that definition of what coaches do. So home health aides provide non-medical services and support for clients who need help with basic daily activities and physical care, or require assistance with shopping, cooking, or paying bills. They may assist in the safe and effective care of clients under the direct supervision of licensed professional nurses. Care may be provided to the elderly, individuals with physical or developmental disabilities, and those with rehabilitation needs. The duty of home health aides vary based on the type of home care setting. So then, I'm talking about historical brick and mortar, but kind of fast forward now to digital telehealth. I work with a few kind of startup companies that are doing virtual senior care or coaching. And they are doing, making those doctor's appointments, organizing for groceries to be ordered for not a patient, a customer, because they're providing these sort of assistant needs, right? Calling patients, customers, to make sure that they're taking their medications. And so if you've got a business that's hiring unlicensed personnel to provide purely assistant services, that can be done, right? They're not diagnosing, treating, recommending nutrition. They're really serving as an aid or an assistant to someone that needs it. But then those services can be integrated into professional services, like the RPM and CCM services that were mentioned. It could be that there's unlicensed personnel working with an RPM company, helping remind patients to take medications, tracking data that the RPM company is utilizing for its services. But then the company is working directly with a physician and feeding the data to the physician, and the physician is the one that's ultimately making decisions and using it. The last area I'll talk about, well, at least for now, is behavioral health. And that's where things get very tricky. So I personally think it's very difficult for a coaching sort of company to offer behavioral health care services without the involvement of licensed clinicians. It's too easy to sort of tiptoe into providing licensed psychology services or licensed counseling services to hold yourself out as being able to provide some kind of, call it coaching, but it ultimately ends up being counseling. In just about every state, advertising or providing a licensed service without a license is a crime. So there's definitely risk there. And then if you do have licensed people involved, then you do have that sort of flexibility to hire the coaches. But again, the liability falls under the licensed people. So you've got licensed psychiatrists and psychologists and counselors that have coaches to kind of hold patients' hands maybe in between appointments. You know, you have your appointment and then the coach checks in on you, how are you doing, maybe takes some information to report back to the professional, which is all well and good. But it's very hard to control those conversations. It's not like coaches have scripts, or maybe they should have scripts. But if they start recommending, like, oh, have you tried taking iron? Maybe that would give you more energy. You know, you can see how it can easily kind of fall within or outside the scope of what those coaches should be doing. Maybe I said that was the last thing, but the very last thing I'll mention, and I'm not sure how relevant it is to this group, but I mention it because it always comes up with my clients that are engaging unlicensed personnel, not just coaches, is corporate practice of medicine. So most states, more than half at least the states in the country, restrict the corporate practice of medicine and other healthcare professionals, which means that licensed healthcare professionals cannot be employed by general business corporations. And when I work with clients that are hiring coaches or unlicensed personnel, there's often a desire to have those personnel employed by the general business corporation and not necessarily a professional entity. And that can work, but if the coach is working under the supervision of a physician or a nurse or a licensed person, you do usually need the involvement of a professional corporation, a PC, a PLLC. And it actually comes up in the area of nutritionists and dietitians as well. Many states do not restrict the corporate practice of nutrition and dietitian, but some states, like New York, do. So when you have companies that are trying to scale, that think they can employ all their staff at a general business corporation, want to move to New York, all of a sudden you have to form a professional entity owned by professions. So that's everything I have for now. I don't know if you want, well, I'll hand it over to Krista for questions. Well, do we want to go to the tabletop or questions with us?
Well, if you want to give like an overview of like what's something and then maybe bring it back in.
On the risks?
Yeah.
Yeah, sure. So our tabletop question is, what is the risk of using health coaches in a clinical setting? I think you heard some of the risks that we think there are. I'll give a few more since I'm standing here. And I do have some notes. So I'll give you a practical risk from a business perspective, at least. If you're, outside of like the health system clients, if you're working on a business, a telehealth platform, and you're a startup or you're a young company, you're going to want investment, right? You're going to want to raise money. And when you get larger and you get larger investments, those investors will have Healthcare Regulatory Council due diligence on your company, and they will want to ensure that you are operating compliantly. And if you are not, they won't invest in you. And even in larger hospitals, PCs, if you're doing things non-compliantly, there's this real business risk that when you go to grow or merge, you discover problems. So that's a practical risk. And then there's the real legal ones. As I mentioned, practicing a profession without a license can be a crime. There's the liability on the physician or nurse practitioner that might be supervising. So I guess, pose to you any other risks you might see of using health coaches in a clinical setting. And I don't want to pose it so negatively either. I would say any risks or rewards, because maybe we want to be positive too of using health coaches in a clinical setting. So we'll give you 5 minutes. 5 minutes good? Okay, 5 minutes.
All right, guys. All right, we're deep in thought. Let's throw it out to the group. What did you come up with? I think we're going to call you guys, no? Okay, table one. I don't know, Becca?
I think we've had a conversation.
All right.
Do you want me to talk again?
In the interest of time, we have another panel creeping up on
You want me to do it? You do it.
You sure do it.
Go.
Okay.
I already talked to the mic once.
So we did have a lively conversation, and I think a lot of the concerns you raised were there was a sentiment here of how can we find that place for health coaches to really understand, well, not we find the place, but for those boundaries to understand if they're working on specific areas of coaching, where does that training that they're getting, how is that supervision happening? Concerns about observations that I have seen, I'm not sure of others, that there's both a place for coaching. However, there is a concern about crossing, particularly in the behavioral change area, of not having adequate training or in a structure where there's adequate supervision, and how what's the impact of that on the consumer? There were other comments.
Yeah,
that
we
came
had
up on
lots
this
of other
too.
comments.
We
We
had
could
lots
keep
of
going, but we'll let other people talk.
Zach's new to CTeL, so Zach, introduce yourself.
Well, I'm actually here for my boss who decided to stay home on this trip. So, hi everybody. I'm Zach. I'm from University of Utah Health. Our table. So at the University of Utah, we took the positive route, just so you know, not the risks, but what are the benefits. Our oncology departments actually use exercise sports scientists a lot to do wellness classes in like a health coaching type setting. And so a lot of our departments have embraced coaching done virtual. In fact, we're trying to expand that into some more mental health areas. We're an Epic facility. We're trying to utilize the group group visits functionality that's been rolled out through Epic and expand that into mental health to actually be able to do not only more wellness classes, but group therapy sessions as well. And so we've kind of embraced it. We're running with it. It's still growing at our facility, but group sessions and health coaching to that regard is something that we've been working with quite a bit. So yeah, thanks for the opportunity.
Yeah, and I would respond on the groups. I think that is a place where coaching can really work well when there isn't that individualized advice being given. The group therapy, obviously, it gets individual, but a wellness class, where it's educational and the coach or unlicensed person is giving a webinar or standing up here like this and saying, here's everything we know about eating right, if you have high blood pressure, and giving sort of education, but not necessarily individually, treating or giving a particular diet for one person.
So Molly Case, Parkland Health. And so at our table, one of the big discussions that we had was just the name of the role, really. So being a health coach, it leads the patients to believing they can ask those additional questions. So maybe consideration for the actual name of whatever that role is as we're moving forward. The other thing that we really had a lot of conversation with is, I'm a nurse, I'm a trained nurse, but I went and got one of these certifications as a health coach just to see what it was like so we would have an understanding. And what I found, and now granted it's comparing it to my nursing education, but it didn't require much. And that's very concerning. I literally felt like as I took it, anybody could go be a health coach. And so I think there definitely needs to be some structure there.
That was one thing I did want to, I know we're running out of time, but just comment on that, from the billing side of things, they can't directly bill at this time. They have Category 3 AMA code, just, as far like a surveillance or studying it. I think they are billing under other providers potentially, but when I look at the landscape and where I got the most positive stories were healthcare providers that are a qualified healthcare provider that then get a coaching certificate as like another tool to add to their toolbox. That I would venture to guess that you're seeing more success with that model where they already are a trained healthcare provider, and then coaching is itself and that scope of practice that I talked about, it's just a different framework, a different way to approach your care, whether that's as a dietitian or in exercise or physical therapy. When you have these people that are getting this 6-week coaching certificate and that's all they have and they don't have a medical background, I question, what is the effectiveness? And I think that's where this year in the physician's fee schedule, where Medicare landed when they tried to get codes that they could actually bill for, they questioned whether there was clarity between what providers are already billing for as a service like dietitians, medical nutrition therapy, and the coaching. And they also questioned the research supporting it and said they need more than anecdotal information, that they needed some clear peer-reviewed studies to show the effectiveness.
This is our last question because Because we're a few minutes over.
Sure. And thanks for teeing that up, Charlotte. I appreciate that. Story time, kids. So I'm Micah Matthews. I work for the Washington Medical Commission. And this year we had a physician assistant that went nuts with the ivermectin and all the other conspiracy theory stuffs. And so we suspended him. What he immediately pivoted to was turning his pediatric clinic into a health and wellness clinic. And he became a health and wellness coach, where he was, frankly, honestly practicing medicine. And so, but it was under the guise of wellness coaching and recommendations, vitamins, and all that other stuff. So the biggest concern we see is there's no one, Washington State, this was in the south of the Washington State, so yeah. No one's really looking at this. So that's why it's rife with abuse. That's why you see health coaches that are TikTok and Instagram influencers. It's very easy to get into, and it's very unaccountable. So I think that's the problem we see with it.
But shouldn't it be accountable, though? Because you, as the Washington Medical Commission, can then, you probably have to get your Department of Justice involved. But
I'm very happy to not be the one holding them accountable.
I understand that, if that person who is a doctor or PA is acting in such a way that they're clearly practicing medicine without a license, there's a law in every 50 states that prohibits that.
Right. It results in cease and desist orders mostly. And that's not exact. I mean, we strongly considered, right, we revoked him after that. We strongly considered sending the OIG down there with some handcuffs, but that's such a few and far between response for unlicensed practice.
Well,
That's what we're talking about. There's so
that's
many
it.
instances of enforcement that it's hard to.
Oh yeah, the best part was for COVID, they were recommending nutrition shakes be taken to the patients in the ICU against the actual treating physician orders. So yeah, it was a great experience.
Yeah, I think that's the other part of the problem is you've hit it, Jacob, on the head is the enforcement side for a lot of the licensing boards, especially since the dental board case out of Florida, the teeth whitening case. I think a lot of our licensing boards are, hesitant to take action when it comes to unlicensed persons. I mean, I've had many discussions, I know, with our North Carolina Medical Board, and where they land leaves me very frustrated in their, when it comes to unlicensed persons. Whether there's capacity questions and ability with the number of people out there providing this level of services, but then they've also, what's been achieved or for so many of these think tanks is there is, I just think, a hesitancy to enforce the laws against unlicensed persons.
So we're probably going to need a part 2 to this conversation because I have a lot of people that still wanted to talk. So it's good that we have something here. All right, friends, last session of the day. I need Brian Arkwright, Jasmine Bishop, and Lisa Mae Williams.